Hi everyone, and welcome to today's episode of Aesthetics and Wellness by Dr Yusra. Today I have the lovely Dr Lauren, and we have talked all things hyperpigmentation. We have dispelled myths about treatments of hyperpigmentation. We have given you guidance on what ingredients to look for and how these treatments may potentially help you. And one of the most important things that you should be doing at home. Tune in to find out more. Hi everyone, welcome to today's podcast. Today I have the lovely Dr. Lauren Mullan, who is our superstar, who travels all over, comes into our Liverpool clinic twice a week, is available on Saturdays, and does a heck of a lot of skin rejuvenation, skin resurfacing, CO2 lasers, acne scarring, and a lot of pigmentation treatments. Hi, Lauren.
Hello. How are you?
I'm fine. How are you?
Good.
Thank you for coming.
You're welcome.
Tell me a little bit about you.
My background is in dentistry like yourself. I've been a dentist for 5 years, and I kind of split my time between aesthetics and dentistry. I do a lot of skin treatments, as you've mentioned, and a lot of injectable treatments as well, focusing on facial harmonization, skin boosting treatments, polynucleotides, as well as all the skin treatments that we can provide, as I'm sure we'll talk about soon.
Yes. I mean, I call you the pigmentation queen in our clinic because I'm referring my pigmentation patients to you. So let's talk pigmentation. Hyperpigmentation is one of the most upsetting conditions to have. It can be really difficult for patients to get rid of. And we see a whole range of different types of hyperpigmentation. They are not all the same. You have hyperpigmentation secondary to sunspots, aging. You have hyperpigmentation that is secondary to blemishes or injury, called post-inflammatory hyperpigmentation. Then you have what we call the mask of pregnancy, or hormonal fluctuations that result in melasma or colasma, which is a chronic, dermal, deep, really difficult to get rid of hyperpigmentation. And we treat them all, and we do an amazing job at it, I must say. And I think we really, really help our patients to get incredible long-lasting outcomes. But with that comes a lot of education, a lot of skin priming, a lot of aftercare, where patients have to stick to have to be consistent with their skincare. And I often say to my patients, look, we can help you, we can transform your skin. But this is like going to the dentist. You don't just brush your teeth the day that you go to the dentist. It's important that you do your homework and that you brush your teeth every single day, even if you only go to the dentist once a year or twice a year. So it's the same kind of concept. They have to be consistent. So talk to me about what you see, the treatments that you do, what types of hyperpigmentation you treat.
Yeah, so we actually see a broad range of hyperpigmentation. I'd say that the majority of hyperpigmentation that we see is due to sun damage. So it's really important to actually distinguish what the cause has been, and help to diagnose which type of pigmentation it is. And that will help us plan the treatment pathway for that patient to get them the best result that they can. We see a lot of hyperpigmentation from sun damage. We see a lot of melasma, particularly because that is probably the most difficult to get rid of or to diminish. And post-inflammatory pigmentation post-pregnancy or injury. So whether it be acne scarring, which can leave a lot of stubborn pigmentation quite deep underneath the skin, as well as scarring. We see a broad range, and we can actually pick different types of treatments and different modalities of treatment to actually help that patient, which is great.
Okay, so how do you treat, what is your go-to when it comes to treatment of hyperpigmentation? And does it differ according to the types of pigmentation? Probably the go-to one that we do the most, or I would do the most, is from the Mesoaesthetic range. So their whole range is really targeting pigmentation. So one called Mullan or Mullan. And every product that the patient will use at home and the products that we would use in clinic, they're all geared to kind of target that pigmentation from the cellular processes. So to actually reverse the melanin production. So the melanin is what gives us that colour of our skin. And when we've got hyperpigmentation, it's been an overproduction of that melanin. So their range actually stops an enzyme reaction from happening, so that melanin is not made at the base of the skin. And it also helps to reverse that stubborn pigmentation at the top of the skin in the corneum, stratum corneum, I should say. And it works along those two pathways to both reduce pigmentation and actually regulate the production of it, so that hopefully in future that pigmentation expression is not as much in that area. We really like doing that, and it's
it's a long process, so the patient does have to be committed to it, but we get fantastic results from it. So we usually start by prepping the skin. Now, it's so important if you're going to have any kind of pigmentation treatment to prep the skin correctly, because that is going to help the products penetrate evenly and deep enough into the skin. We've got multiple layers of the skin. A lot of products, 7 layers. And a lot of the products, you know, they will work on the superficial layers. Yeah. And yes, they may improve that pigmentation, but actually what you see on the surface is just the tip of the iceberg. So you want something that's able to penetrate all the way down to the base layer to help reduce that pigmentation expression.
So, okay, let's talk about this, and I'm right down to the core, the basics. Okay, so scientific basic, we've talked about hyperpigmentation, how it works and how it can be treated, but when it comes to why some patients get pigmentation more than others, part of that can also be skin color content.
Absolutely.
And we treat all skin colors in our clinic. Patients who are white, fair, blue eyes, blonde, like the lovely Holly over there. And then patients who are darker like myself, who have more olive skin tone, dark hair, dark eyes, are more prone to hyperpigmentation because of the types of melanin. Now, there's 2 different types. There's pheomelanin and eumelanin. And melanin is essentially pigment, and it's created by a cell called melanocytes. And these melanocytes have little hands like this. Okay, so like that's how I imagine it, right? Right. And every single finger lays down pigment. Yeah. And they actually are really quite fast acting. So any cut, bite, injury, sun exposure, and these melanocytes go into hyperdrive and start to lay down pigment. Now, I see a lot of patients, particularly in Liverpool, who run after pigment. You know, they go on sunbeds and are sun tanning, and Holly's laughing there in the corner because it's true, right? And I have a clinic in London and I have a clinic in Liverpool, and certainly this is something that I see a lot more in Liverpool. Although we're starting to see a shift because patients are becoming educated that sun exposure and sunbeds can predispose them to cancer. Yeah. So there is no such thing as a safe suntan. And I think that's a really important message that I want to get out. I want patients to understand that when they are exposing themselves to UV beds, what they are doing is accelerating their aging. They're resulting in premature aging. And they are predisposing themselves to an increased risk of developing skin cancer. And there are different types of skin cancer. There is squamous cell carcinoma. There is basal cell carcinoma. There is melanoma. And I have seen in our clinic multiple patients with skin cancer. And I always find it really sad because I think this is an avoidable disease. Yeah. This is something that is resultant from our lifestyle the majority of the time. Yes, of course, there might be a genetic predisposition, but if we can save even one life, I think it's an important message is stop sunbeds and stop them now. If you are one of those patients going under UV beds, stop doing it. You might look good in the short term, but long term, the amount of damage you're doing is crazy. And we in fact know that 90% of premature aging comes from sun exposure, which means only 10% is like hereditary or genetic, right? So if you can stop that, you're going to look like 20 when you're 50, which is awesome. So that's, I think, a huge life-changing nugget of information that can safeguard patients long term. Now, the thing with pigmentation and sun exposure is at the beginning it might look nice and tanny and like even tone, but actually we know that you don't get this even pigmentation, that underneath the skin you get these deposits of dark, uneven blotches of pigment. And that can take 20 years to surface. So the damage you've done in your 20s will only start to surface in your 40s, which is why we see a lot of patients who are late 30s, mid-30s, late 30s and above, who are coming in with a lot of pigmentation saying, it wasn't ever this bad. I used to get some freckles and it wasn't this bad. And we always say it's like the tip of the iceberg, what you see in the surface. And it's a lot worse underneath, isn't it? So when are you, and you're using a wide range of different, one of them is mesostatic, but a wide range of different products. And I think for us, we're very much ingredient driven. Absolutely. So whenever I put something on my skin or when I'm telling patients to put something on their skin, it's got to have an end goal of an outcome. Yeah. So it's got to improve collagen production, or it's got to reduce pigmentation. It's got to enhance the radiance. There's got to be something. Yeah. Otherwise, you're just throwing money down the drain and clogging your pores for no reason. Like, I'm not into this placebo effect monarchy. We are results driven, evidence based. Absolutely. So let's talk science. What are the ingredients in that you are looking for when you're treating pigmentation?
Yeah, so probably the two big hero products would be one called Tranexamic acid, which is found in the mesoaesthetic range, or hydroquinone or tretinoin as well, actually. So they're kind of the three big players, I would say, in the pigmentation game. And they all work slightly differently, but they all kind of help to reduce that enzyme reaction that happens to cause that pigmentation. There is other ingredients as well, things like kojic acid. There's a multitude of ingredients.
We hear a lot about kojic acid.
Yeah.
I think there's a lot of good information, but also maybe extra hype, and patients don't understand the limitation of it.
Absolutely.
Let's talk about kojic acid.
Yeah, I think it's a really nice thing to help combat the pigmentation, but you can't use it on its own. It's not going to penetrate deep enough. It's not going to, stop that cellular reaction enough. I think it's really good in combination with those other things. So I think kojic acid is one of the ingredients that I would look for in products. I don't think it's a standalone ingredient. I think it works best in combination with some of those other ingredients that I mentioned, whether it be tranexamic acid, hydroquinone, retinol. And I think it's very important to pick a brand or pick a product that encompasses a lot of those in the one thing, because that way it's going to penetrate into different layers of the skin. It's going to target different pathways, and that way you'll get a whole, a more all-round approach to targeting that pigmentation.
So there's two different types of pigmentation, or two different layers that pigmentation might be sitting in. One is epidermal and one is dermal.
Yeah.
Epidermal pigmentation we can get rid of really quickly.
Yeah.
And I'm going to talk a little bit about post-inflammatory hyperpigmentation, because this is something I suffer with really easily. I am, I've got darker skin, darker hair. I'm Fitzpatrick skin type 4 in the color scale. And what that means is one spot and I'm pigmented. And it's kind of like a brown-red pigment.
Yeah.
It's not just brown pigment, it's that reddish bit as well. And that's it. We know post-inflammatory hyperpigmentation is annoying and left untreated can last years. Yeah. And I mean, I have patients who tell me this has been there for 3-4 years and it just will not shift. But that is because of ineffective skincare. And what we do know is using effective skincare, we can get rid of it really quite quickly. And I'm talking about months, not years. Okay. Because epidermis is the upper layer of the skin, and we can shed that with the right ingredients, like you mentioned, tretinoin. Tretinoin is a vitamin A derivative. It is retinoic acid. It is the purest form and only available on prescription, which means you can only get it from a medical prescriber. And what it does is it stimulates cellular turnover, mitosis and meiosis, cell replication. So now we're starting to get cell replication of fibroblasts, keratinocytes, which are laying down new collagen, laying down new skin cells, and new healthier skin cells. And if you combine that with hydroquinone, which is what we call a tyrosinase inhibitor, it inhibits the formation of pigmentation. In combination, tretinoin and hydroquinone are the gold standard for treatment of hyperpigmentation and have been clinically proven again and again and again and again with multiple randomized controlled trials, which is the highest form of clinical evidence, to show that they stimulate new cell turnover and improve the appearance of pigmentation and reduce cellular aging. So what we're doing is feeding and fertilizing the skin with the vitamin A, the retinoic acid, feeding and fertilizing the skin with hydroquinone, which will suppress formation of new pigment. So all these new skin cells that you've just made don't have the pigment, and then they come up to the surface, and then we can shed post-inflammatory hyperpigmentation. So if you are a patient who gets little blemishes after acne, don't fret, don't panic, but don't suffer in silence. There's absolutely things you can do about it, but they do require medical grade intervention, prescription intervention, and they can shift quite quickly. When I see post-inflammatory hyperpigmentation, I'm almost quite happy because I think, I can make a big difference here quick. When I see melasma, I'm a little bit more conscious and cautious, because I know melasma is multifactorial in its nature, and it's deep, sitting in the dermis. And when we're putting skincare products on, it is really hard to get skincare to penetrate through those 7 layers of epidermis. People don't get that. And I think people go over the counter and they buy this Elemis and, I don't know, other, Boots number 7 and, spa level skincare, which can't penetrate into the dermal layer. So it sits in the epidermis, feels great, feels awesome. And the reason why it feels awesome is very high in ceramides, glycerin, dimethicone, products that make the epidermis very hydrated, sometimes too hydrated. So again, this is something that I think patients really need to understand, is we actually have the ability to moisturize our skin ourselves. We have something called natural moisturizing factor present in our skin. And natural moisturizing factor hydrates our skin to 12%. We're not putting moisturizer on our babies' faces. Right? We don't do it on our children's faces. And I'm telling you, men don't do it. Or very few men do it. Okay, I have been married. I've known my husband for hold on. I was 19 when I met this man. A good proportion of my life. And I've been trying to convince him to wear SPF and moisturize and use retinol. And it's a fighting battle.
Yeah, it's a struggle.
So it's a real struggle. But what I find is they're not reliant on it, right? No. They get on a flight. We literally, long haul flight, all the women are pulling out their sheet masks. They've got moisturizer coming on. They're like really struggling to maintain their skin barrier. Men are chilling because they have never switched off their own natural moisturizing factor. What women have done is they have overhydrated their epidermis, felt great in their 20s. They hit mid-30s, they're aging rapidly, okay? Because what they have inadvertently done is switched off their skin's ability to hydrate itself. When you overhydrate your skin and you're using moisturizers that are moisturizing your skin at 19% and above, and remember, physiological moisturization, the NMF, the natural moisturizing factor, hydrates the epidermis to 12%. So if you're using a really thick moisturizer that's overhydrating the skin, your skin is a cell that communicates with other cells. Everything is talking to each other in our bodies. So your skin cells are telling the brain, hey, I am in the Amazon here. I am overhydrated. Switch off natural moisturizing factor. I do not need it. I'm getting all this external hydration. If you chronically switch off NMF, your body stops creating it. You then become dependent on the moisturizer. So sometimes when patients are coming in to see me and they've been using Elemis and other, I'm not like, please Elemis don't sue me, but other brands that are overhydrating the skin, what ends up happening is I have to really slowly titrate my patients off it so that I'm not getting them dry. I'm like switching them to a natural moisturizing factor, which then switches on their body's own capacity and capability of hydrating itself, which means they're not reliant on skincare. I mean, ultimately, our skin's very clever. What we do need is we need stimulation of it. What we do need is we need protection of it. It's the largest organ. So one of the most important things for a patient who has pigmentation is to protect the skin with SPF. It's a non-negotiable. And we have very high SPFs in our clinic, don't we? We've got full-on SPF 50, 60, 70. We've got chemical SPFs and we have mineral SPFs. And I prefer minerals, generally speaking. That's a podcast for maybe another day. Well, I've actually spoken about it on my lifestyle podcast with Dr. Kate. I think mineral SPFs are much better for patients with pigmentation. And I'll explain why, actually. A chemical SPF relies on a chemical reaction. So when the sun's rays hits the skin, the chemical SPF undergoes a chemical change and it takes the sun's light rays and switches it to heat. But if you're pigmentation prone, heat will also cause pigmentation. So that's actually one of the worst things that you can do for your skin because that heat will stimulate pigment. So in a patient who is pigment prone, I always say, please try to get a mineral SPF, which will deflect the sun's rays rather than convert the sun's rays from light to heat. Everything is energy. And it will just convert it to a different energy. So that's my caveat when I'm treating hyperpigmentation in particular. So SPF, non-negotiable. And then SPF, how long does it last?
So you really need to reapplying it every 2 hours, actually, especially if it's a sunny day. But even in the cloudy, rainy, horrible days that we've been having, you still need to put it on. And that's what we always educate our patients about. A lot of patients work from home now, but if you're sitting indoors and there's a window, those UVA, UVB lights, they're still penetrating and they can still damage the skin. So, we always say, brush your teeth, put your SPF on. Exactly. It's like the two things you should definitely do in the morning, and floss.
and floss, exactly. So do you hear that? Do you hear patients say, oh, well, I'm sitting at home, so I don't really need to wear SPF?
And I can understand the concept why, but, when we explain actually, as long as there's daylight in the room, there is potential for damage. And especially if you're trying to treat pigmentation, you want to block out whatever triggers that you can, sunlight being probably the number one trigger. There is, genetic predispositional triggers, hormonal triggers, and that's where a lot of these pharmaceutical grade products will come into play as well. super important. And we even have an SPF of 130 at the moment as well. It's actually quite nice.
Yes, it is, yeah. That's really interesting because I think I hear that a lot. And I also hear patients go, I've got makeup I've got SPF in my makeup, or I've got SPF in my cream. And I'm like, oh God.
I know, it's just like watering it down. It's not enough.
Exactly. So what people don't realize, it's basically diluted. And SPF is measured per gram. So the effectiveness of SPF is measured per gram. So if you've got it in a moisturizer, you've got it in your makeup, it's diluted basically. And you're definitely not putting enough on. So when I'm educating my patients about SPF, you need 2 finger lengths of SPF to appropriately cover your skin. Anything less than that is not going to be effective. And you need to top up every 2 hours, particularly when you're in the sun. And then another one is blue light. You know, when they're sitting in front of their computers all day, blue light has been shown to penetrate. Blue light is what is emitted from our computer screens, our phones, our laptops, our iPads. Blue light has been shown to penetrate deeper into the skin. And people also think that if it's rainy, cloudy, a winter day, I don't really need to wear SPF because look, it's grey and another British weather day. But actually, we know that even if it's cloudy, even if it's rainy, guess what? That UV rays that can still penetrate through clouds. So it makes zero difference. What does change is we have 2 different types of rays. You have UVA and you have UVB. And I always say, think A for aging and B for burning. UVB comes out once a year, 24th of July kind of time. Makes us feel good. We all sit outside like bathing in it because we don't get much of it. And that is UVB. Okay, B for burning. That's that hot sun, warm ray. UVA, A for aging, which changes the cellular structure, comes through all day, every day, 365 days a year, whether it's sunny, rainy, snowing, grim, whatever, it's there. And it's aging you. And there are multiple studies that have shown that. And also there are multiple studies, clinical studies, that have proven that with 100% sun blockage, you will minimize pigmentation by 90%. So that is the number one. That's like, there is no point doing anything else until your SPF is on point. Okay, so now let's talk about this concept of, and I hear this a lot, which I must say I don't believe in, but I hear a lot of people saying, oh, I've heard that you can't use hydroquinone because it might cause cancer, or I've heard you can't use hydroquinone in dark skin types. Or I've heard if you use hydroquinone and stop it, the pigmentation comes back. Let's dispel these myths. What do you have to say about that?
I think hydroquinone, I've seen it firsthand, is probably one of the best ingredients to targeting hyperpigmentation in all its forms, whether it's melasma, post-inflammatory, etc. And, you know, it's not, this is not true. So I think, you know, if you're using hydroquinone, first and foremost, you need to see a medical professional who knows how to use it and understands how it works. And, you know, you start yourself slow, you work up with it, similar with tretinoin. And, you know, after a course of maybe 3 months, so 12 weeks, you should see a difference in your skin. And then it's time to think, will I continue with this or should I switch to a different product? So, I think it's just all about using the product correctly. And if used correctly and you're still maintaining some kind of depigmentation product on your skin, that pigmentation should not come back.
Correct.
If you go on a holiday in the sun and you haven't really worn your SPF, you know, you will get a few blemishes come back, but then you can work to reverse that again. So it's not just sunlight, it's things like heat, stress, pregnancy, hormonal changes, even oral contraception as well. So, you know, throughout our life, you know, situations are going to change. It's not a one-stop shop. You do have to keep on top of it for sure. There's certainly, you know, myth to that. But if you went cold turkey, didn't use anything, didn't protect your skin, that pigmentation is going to come back. It's nothing to do with the hydroquinone or the product you used. It's what you've done or not done to protect your skin.
Amen, sister. I liken this to brushing your teeth all the time. So patients say to me, oh, will I have to do it for life? Well, you have to do skincare for life because it's like saying, oh, do I have to brush my teeth for life? Well, if you want to look after your teeth, yes. You know, I always say floss the teeth you want to keep. Your choice. It is totally your choice. But it's important that patients understand that, right? Because if they think, well, I'll just do a course of treatment and then I'm not going to wear SPF, I'm not going to bother with my skin, of course the situation will recur. If you go to the dentist, you get your teeth cleaned, but then you don't brush your teeth, you don't floss, of course you're going to have bad breath and caries and gum disease. That's it. That is the fundamental basis take-home message, is maintain and look after what you want to keep. And I have treated patients 9 years ago. I was looking at my case studies recently. And 9 years ago, I treated a patient with really bad melasma. And she had tried so many over-the-counter products that were nonsense, you know. And sometimes I go around Boots and I see these products that say anti-pigmentation. I think, liars. This is false marketing. This is capitalizing on patients' vulnerabilities. Don't waste money on products that don't work. Even if they're cheap and cheerful, they ain't gonna work. No. And what will happen is you're throwing your good hard-earned cash down the drain, which you could save up and use towards an effective skincare product. So that really upsets me when I see people capitalizing on vulnerabilities. But going back to this patient, I treated her 9 years ago with a combination of tretinoin, which is retinoic acid, prescription grade, hydroquinone, again, prescription grade, and glycolic and phytic acid, which is, again, fantastic for skin rejuvenation. And until today, 9 years later, her pigmentation hasn't come back. Why? Amazing. Why hasn't it come back? First and foremost, I pulse treatment. So my protocols are really, you know, have been fine-tuned and tested with decades of experience. And what I did with her is I pulse treatment. She was on a strong dose, and everything is dose dependent again. A strong dose of hydroquinone and tretinoin. 4 months later, we came off it, switched her to arbutin, which is a cousin of hydroquinone. Comes from, you get it in mushroom, you get it in broccoli. And obviously don't put broccoli on your face, but that's where it comes from. And what it does is it suppresses pigmentation. And they work slightly differently. Hydroquinone is the strongest formulation of it. Works phenomenally for patients who have melasma. And then you can maintain it with non-prescription products. So as long as you are appropriately maintaining and protecting your skin, there is no reason why it should come back. And if you do go to a hot country and expose yourself to sun, which can and does happen, we can get rid of it really easily because we're already primed that skin. So I think, you know, yes, melasma is chronic. Melasma can be hormonal. And it's a disease. It's a disease of the melanocytes, in the same way you might get a disease like diabetes or a disease like arthritis, which you have to manage for life. Everyone has something. I have arthritis. I've got to manage that. I've got to really be mindful of my lifestyle to prevent that from flaring up. If you've got melasma, you have to be mindful of avoiding the triggers. And that is very important, that we are clear. You know, we're clear with our patients about that. So you do a lot of the skin peels as well. You do a lot of the what is in those skin peels? Those brown mask skin. What are the active ingredients? Because patients keep it on for 8 hours, 12 hours, depends on which one you use.
Absolutely.
Talk me through those skin peels.
So those ones that you mentioned, they are primarily tranexamic acid, which is the main ingredient that's going to help stop that enzyme reaction, but it's also filled with everything else to help nourish the skin as well. So it's even got like glycolic acid in it to kind of boost the hydration of the skin. Also has vitamin A in it, which we know is tretinoin. There's, you know, everything you basically want in a skin care brand is in that, but all geared to, you know, treat that pigmentation, but keep the skin hydrated, because, you know, there's no point in treating just one thing, but then if the hydration goes down, you're going to get other problems. So you've got an in-clinic peel, which kind of kickstarts that process.
This is a professional peel,
professional peel type yes thing. And depending on which one it is, you want to keep it on for at least 4 hours. And the patient will go home with that mask on, and actually another little mask on the top to actually make little microchannels in the skin to help deliver the ingredients deep down into the skin. And then they will have an actual active treatment to start using at home as well, to keep boosting the process, as well as, you know, your SPF, as well as a cleanser to kind of clean the dirt every day. Because if your skin's not cleansed and we've got skin cells building up, whatever products you're going to use are not going to penetrate deep enough. So it's, you know, you keep it quite simple, but you're using the correct ingredients to treat whatever it is that you're trying to target. So yeah, we do a lot of the clay masks and lots of different peels as well. Things like Perfect Peel, New Derm Peel, Blue Real Radiance.
And you do a lot of the, I know that you do a lot of microneedling with the peel.
Yes, absolutely. And that is a lovely treatment to help target stubborn pigmentation that's just sitting on right underneath the skin. So we tend to use that for patients who may have stubborn melasma. So they've went through a course of a deep peel, they've done all the home care, and they're just supporting this now. So we can actually microneedle the skin and actually put depigmentation solutions in there. And you would
so when you're microneedling, you're creating pores or channels.
That's it, yeah.
And then introducing the peel so it penetrates into the dermis.
Much deeper than just, applying it on the skin without those little channels being made. And that is fantastic to help support what you're doing at home and helping to manage the long term. And patients quite like it, actually. They leave and their skin feels nice, it feels hydrated, but they know they're actually getting the ingredients down to where they need it. And it's a really nice thing to do to kind of help finish off some of that targeted treatment that we're doing before we move on to the kind of maintenance phases as well.
Got it. Okay. So we've talked kojic acid, we've talked tranexamic acid. Tranexamic acid is probably one of the game changers in the aesthetic arena for pigmentation, because it doesn't just treat post-inflammatory pigmentation, it treats post-inflammatory erythema, which is the red mark. Remember I said that I get those red marks? That has been game changing for me, and I use that every single day, morning and night. Literally game changing. And what it does is, with the tranexamic acid, actually was given to patients orally in the past, and what for bleeding, it's actually coagulant. It helps to stop when women have heavy menstruation or heavy bleeds, and it helps to stop bleeding. But when you put it, what they found was, it helps with pigmentation. Now, when you put it in skincare, it helps to coagulate and stop the formation of pigmentation and post-inflammatory erythema. So it's an adjunct. And I think that's another important thing to understand, is no one treatment and no one ingredient is going to be the game changing. We have to utilize a range of different ingredients in combination with each other to target different levels of the skin, different layers of pigmentation, and also maintain the results. You don't want to just get rid of it. You want to maintain your results for as long as possible. So longevity is really important. So tranexamic acid, hydroquinone, tretinoin, we've dispelled the myth that hydroquinone is bad for you. Hydroquinone is fantastic, but it's really important that it's done under prescription, under supervision. Remember, there are risks, of course, like there are with any ingredient, any skincare, any treatment that you perform. The particular concern with regards to unsupervised and uncontrolled doses of hydroquinone is a side effect called ochronosis, which is long-term brown pigmentation of the skin. And that can be permanent, but that is not seen with the levels that we use. We use 4%. That is seen with 9% and above uncontrolled use. Usually bought in India, in Pakistan, in Southeast Asia, in Arabia, in the Middle East, because it's uncontrolled. They literally pick up. I mean, I remember when I was a kid growing up, I used to go to, in the Middle East, I used to go to shops and they used to sell this cream called Fair and Lovely, because it was deemed that if you were fair, you were lovely. And if you were dark, you were not. How horrible, how awful.
It's terrible.
And again, capitalizing on those insecurities, right? And it had hydroquinone in uncontrolled doses, and patients were using it every day, all day, and increasing their risk of developing long-term pigmentation called ochronosis. So do not do that. No. Throw those Fair and Lovely down the drain. The answer here and the message is not to make you fair. No, that's not what we want. This is not a Michael Jackson, and I have no disrespect to him, but it's not a Michael Jackson type approach. We're not trying to bleach the skin. We're not.
I think that's a big myth that people are afraid of using that as well.
Exactly. What you're doing is removing sun damage and taking your skin back to its original color when you were born, or the color of non-sun exposed areas, like maybe your bum or your breast that isn't exposed to sun. That is the color that that is the skin tone rather that you will probably achieve once using these treatments. And it's about removing sun damage, not bleaching the skin.
Absolutely.
And I think that's a very important message, because I think all skin colors are gorgeous. And I never want anyone to feel or think otherwise.
Yeah, absolutely. No, I think I'm glad we've mentioned that, because I forgot to mention that as well.
Yeah, I think that's an important one. Is there anything else that you feel is important for our pigmentation patients?
Yeah, I mean, what we always like to do as well, we're very lucky in that we have skin scanners available now, so we can actually monitor the process. So I think if you're trying to target pigmentation, you do need to be patient and consistent. And a way that we can actually monitor the progression or the improvement of the skin is actually by scanning it. So we can scan it under different lights. One of the lights will show deep pigmentation, other lights will show areas of oil, dryness, etc. So it's a really nice way to help monitor the patient's journey. And actually, it'll get to the point where a few months in and they're thinking, I don't know if this is working so well. And then go through the photos, just our normal plain photos, and actually the skin scanner photos, and we can start to see the breakdown in real time. So I think that's a really nice thing that we can offer, because everyone wants to see results instantly, and we don't. So it's important to realize
Amazon Prime
that.
Now generation. But that's that's important, is the consistency in the patients, because it's not an overnight race.
No.
It's a bit of a marathon, but once you get to where you want to go, I've seen your patients. I mean, I have seen how gorgeous and glowy and hydrated their skin looks, and it's life changing.
Yeah, it's not just that getting rid of the pigmentation; it's the whole health of the skin as well.
Yeah. Amazing. Well, thank you so much for joining us.
You're welcome. Thank you for having me.
Thank you for coming, and until next time.